This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Well, thank you all for being on and for letting us talk a little bit about Vanderbilt. I am Bailey Fry. I'm one of the chief residents at Vanderbilt, and I'm also on with Dr. Devin Shannon, who's the other chief here at Vanderbilt. Just a little bit about us. I'm originally from Lawrence, Kansas, and did medical school at the University of Florida. And I'll be applying for, or currently am applying for traumatic brain injury medicine fellowship. And Devin is from Cincinnati, Ohio, did his medical school at Toledo, and he is applying for sports medicine fellowship this year.
Yeah, so thanks for having us, PM&R Scholars. I remember attending some of these events as a medical student trying to make my decision, so appreciate the work that you guys are doing. But just a little bit about who we are as a department. So Dr. Kennedy is our chair of our department. So you might recognize him right now. He's the current president of AAPM&R. He's just a really awesome person to have in the department, really approachable for residents to even just pop in and chat with him and get advice. And he meets with the residents on a quarterly basis, just himself as the chair, which goes a long way. And then right now, our current program director is Dr. Bill Sullivan, but he is actually transitioning out of the role, kind of ending his career in a different position and moving places. So we will have a new program director, Dr. Bob Rinaldi. He's a PEDS PM&R trained physician. He's coming from UT Southwestern, so really excited for him to kind of come into the role, and he'll be starting here shortly with us. But things that'll stay the same. Dr. Kennedy will still be the chair. Dr. Yang will still be our associate program director. And then Irene McCurgan, I would argue, is one of the top program managers in the country. She really keeps our department running smoothly. She keeps Bailey and I in line as well, and does a lot of great stuff for us. So she's a really great resource for us. Kind of the department as a whole, the goal is kind of to be a department that is well known nationally and internationally. So Dr. Kennedy is kind of spearheaded that since he's come to our program, and is really trying to build the faculty into really great thing and really push this program in the next direction.
We like to put this picture up next because our faculty has been growing over the past few years. Dr. Kennedy is constantly interviewing people and looking who could be great additions to our group. You can see we have a really diverse faculty, and as residents, we get to work with all of these different attendings one-on-one at different points throughout our training here. And Dr. Kennedy's vision is also, always trying to find people that really want to work with residents and have that passion for teaching and kind of including us. And so it's been a great experience here.
As far as our current residents go, so we have people from all across the country as far as residency programs go, and a lot of different interests even within the people who are in our program. So as Bailey said, she's doing TBI, and then I'm going to be applying for sports. Our co-PGY4s, Valentine is going into pain medicine, and then Paige Chase is going into palliative care. So we have a lot of wide array of interests, even just among our class, and that extends even to our other classes. But as you can see here, this is a map of where our current residents, as far as medical schools, are coming from. So as you can see, Vanderbilt is there, that star. So we're kind of all over the country. We're pulling residents from, or medical students from. So just like to show that there.
And where do we end up? So our program, the first graduating class was in 2019. And so looking at the fellowships from 2019 to 2024, the main fellowships have been sports medicine, interventional spine for the NAS fellowships, and then ACGME pain. But we also have kind of started to broaden the interest, I think, among residents. And so we've now already had fellows in neuromuscular, spinal cord injury, brain injury, and a VA quality scholar fellow as well. And like Devin said, we're even broadening that to include more brain injury and palliative care this year as well, which we're excited about. We location-wise, residents have matched into fellowships all over the country. Some of these are top fellowships within the nation, within their respective fields. At Vanderbilt itself, we have a NASS interventional spine fellowship within the PM&R department here. And then Vanderbilt also has pain and sports fellowships as well. They are just not housed within the PM&R department. Let's see.
So just a little bit about our program. So we are a categorical program. So that means all 4 years are within the Vanderbilt system. Intern years within the Vanderbilt internal medicine program. They do a really good job of incorporating our residents into that program. You really feel like part of the program and not like you're kind of just a prelim or somebody who's on the outskirts. They treat you like a medicine resident. So it is a really good internal medicine program. So it's nice that we kind of get that experience of high level medicine as an intern for the year. We take 4 residents per class. A nice thing about our program that was something that really drew me to Vanderbilt was that we get exposure to most of the PM&R subspecialties. So something I was looking for was the ability to kind of rotate through what it looks like to be fellowship trained in all the different areas that a PM&R physician can go into. And Vanderbilt does offer that, and you really get kind of that one-on-one experience like Bailey was talking about to see what that really looks like, which kind of can help build with those career decisions down the line. As far as a brief about our rotations, and Bailey will get into this a little bit more in a second, but from an inpatient standpoint, like most programs, we're inpatient heavy as PGY2s, and then it gradually tapers off as you get further into the program. And then I think a unique thing about our program is that we get 4 months of elective selective time between PGY3 and PGY4 years. That really gives you time to explore your interests and really build a schedule that, interests you, and also kind of helps delineate, if you want to do a fellowship or not. Kind of helps you figure some of that out a little bit easier. And then I think a nice part too is that in our outpatient clinics, we have dedicated sports medicine block months, and then also interventional spine months that you kind of do longitudinally across all 3 years for the interventional spine.
So this is kind of a schematic of the rotations that Devin mentioned. For the PGY2 year, I just want to point out it does look a little scary when it says 9 months of inpatient, but it is not all 9 months in a row. As chiefs, we make the schedule every year, and we make sure that our PGY2s only have 3 months of inpatient at one time, and then it's always broken up with a nice outpatient month afterwards. Some of those subspecialties that Devin mentioned, we have specialists in cancer rehab, limb loss rehab, MSK, spine, EMGs, peds, backlift and pump refills, all of those things. And so you really do get a broad exposure to many different fields within PM&R. And then, again, highlighting that this elective selective time of 4 months really is unparalleled from other programs, that we really do get a lot of time to create your own schedule, and we can rotate even within or outside of the department of PM&R. So for example, if someone's really interested in spinal cord injury, they could do a lot of time with urology and be looking at like urodynamic studies and bladder Botox and things like that. If you're interested in spine, you can rotate with both neurosurgery and orthopedic surgery, including serving them in the OR. So it's kind of a neat experience to be able to do see a lot of different things that you might not get to see otherwise.
As far as patient sites go, we rotate in quite a few different places. So our main inpatient hub is at Vanderbilt Stallworth Rehab Hospital. So that's on Vanderbilt's main campus. It's really nice. Most of these places are all on the same campus. So Stallworth, main Vanderbilt University Medical Center, and the Children's Hospital and the Nashville VA are all on the same campus. So you're going to one spot for all of those rotations, which is really nice. Stallworth is a really good rehab hospital. We see a lot of different things there. Obviously, we have spinal cord injury and brain injury trained physicians. So we do have specific services for those. And we also see a lot of stroke. We also have a complex medicine service that runs at Stallworth. That's run by an internal medicine physician, but that we rotate on there as residents. That's where we see a majority of our transplant patients. And Vanderbilt does a lot of transplants every year. So we see all types of transplants and a lot of complicated patients. So it's nice to have that intern year where you're taking a lot of care of complicated patients. So you're prepared for call when you're at the rehab hospital, because it is a standalone facility. Even though it's on the same campus, it's technically under different housing. It's not owned by Vanderbilt, it's owned by Encompass. So there are two different systems. So you do function as a standalone hospital, even though they're on the main medical campus. And then we do consult rotations at Vanderbilt University Medical Center. So that's in the main hospital, kind of go back and forth between Stallworth and the main hospital. Vanderbilt Children's Hospital is where we do our PEDS rotations. We see some inpatient consults there. There's no inpatient like rehab unit, but we'll see consults, and then we'll do outpatient things as well at the Children's Hospital. Nashville and Murfreesboro VA, from a PM&R standpoint, we only do outpatient things in those at those centers. So again, that's all outpatient, generally more MSK, pain, spine, and then also some EMG work at those facilities. And then our outpatient clinics are kind of sprinkled across greater Nashville. So 100 Oaks is just like a big shopping mall type thing that they've converted into a bunch of clinic spaces. So that's where a lot of our outpatient clinics are, but then we do go to some satellite locations to do rotations.
And going into call, so our call is home call. It's really not a significant burden, I think, overall when comparing, when we were looking at programs as medical students. For PGY2s and PGY3s, you split the weekday call, and that comes out to about 2 weekday nights per month. And then for PGY2s, you do 8 weekends and cover all holiday call, which comes out to just 1 or 2 holidays that you're on call as a PGY2. For PGY3s, again, splitting the weekdays, and then you only do 3 weekends of call. And for PGY4, you have no weekday call and only 2 weekends of call. So that means all the other weekends are those golden weekends where you are off both Saturday and Sunday. If you are on an inpatient rotation when you're on call for a weekend, so if you're on like TBI and then you're on call for that Saturday, Sunday, you do actually get also a post-call half day on Monday. So you come in and round, do your notes, and then you are done for the day. So you're not seeing any admissions that day. And home calls, so you're answering pages from home, and then very rarely, if there is some sort of an emergency or a patient that does need to be evaluated in person, you do go in to see them. But I can count on one hand the number of times that I've had to do that, in the middle of the night.
So didactics, when we say rotating curriculum, we have different kind of blocks that we chunk the year into. So we have like neuro rehab, then EMG, sports/MSK, PEDS, and then some general rehab topics that we sprinkle in there, and P&O as well. So we kind of rotate through those every year. It's not necessarily the same lectures that you're getting every year, but the same blocks of schedules. Or the same blocks of didactics. We also have a variety of outside lecturers that we invite to come speak with us. So they'll most of the time do Zoom or online meetings for those, but we get people from all across Vanderbilt to help give us lectures, and sometimes from other programs and across the country, people will come in and give us lectures. Our lectures are Tuesdays and Thursdays, usually from 7:30 to 9 a.m. Sometimes we'll have a 7 a.m. start if it makes better sense for a faculty member who's given the lecture. And it's a mix between in-person and video didactics, just so we can, or Zoom didactics, so that we can kind of get other people to lecture to us. Grand rounds are once a month, and we get a lot of great speakers from across the country. We also have a weekly spine conference 3 weeks out of the month. That's usually on Wednesday mornings from 7 to 8 a.m., where you get to hear from a lot of different faculty members within our interventional spine. And then it's also attended by some of the pain attendings and some of the orthopedic surgeons. So you can hear a lot of different perspectives about spine care, which is really a cool opportunity for residents, especially if that's something you're interested in. We have more of a resident-run journal club that runs about 8 to 9 months out of the year, just on a monthly basis. We pick some articles and get a faculty member to go through the article with us. And then I think a unique thing too is that we have MM&I that is quarterly, and that's actually cases presented by a PGY2 for each of those. So you get the opportunity to present your own MMI and be a part of that kind of decision-making process and making a fishbone diagram and doing some of those things. We also have protected academic half days where we go through an ultrasound curriculum. We go through all the different joints that we can look at under ultrasound. We do that in our cadaver lab with our two MSK sports attendings, Dr. Jones and Dr. Schaff. So they lead that, and we do that yearly. And then we also do an EMG academic half day to go over our EMG skills and practice doing some of those things. And then we also have 2 wellness half days that are protected throughout the year where we'll get together as residents. We'll work in the morning, and then we'll get lunch, and then have the afternoon off, but we usually go do a fun activity like Top Golf, or we did pottery painting the last time that we did that as a group.
Research is something that's definitely encouraged and that all of our residents participate in. It's super easy to get involved with. Oftentimes it's just pretty natural when it's working with faculty mentors and networking through them. But we also have a spreadsheet of all of our faculty with current projects that they're working on, what they might need help on, and their contact information, so that if someone sees something, looking through the sheet that sounds interesting, they can just shoot an email and get involved that way as well. National conferences, we are have a big presence at all of them throughout the year. A significant number of residents do get to go to them every year and present a lot of both posters and also podium presentations.
So as a resident, there are a lot of ways to get involved. There's a lot of sports coverage. So even as a PGY2, you can start covering independently sideline coverage for high school football. There's a really big high school football outreach program run by one of the pediatric sports medicine physicians here. And they do a really good job of getting our department involved to help with that. And then as far as, Vanderbilt Athletics, Nashville Sounds, and the Preds, those are kind of more shadowing opportunities to go along with the sports medicine fellow within the Vanderbilt system, to kind of get exposure to some of those higher level athletic care, which is really cool. And then the marathon coverage is something that I've done the past couple of years, which has been a lot of fun. And again, you're kind of there as the independent provider, 10. And then there are a lot of ways within Vanderbilt to get involved. So we do some teaching of the medical students. That top picture was a group of us who taught some of the MSK skills to the first year the first year medical students at Vanderbilt, and we went over some ultrasound basics with them as well. And then there are other, there are other committees that people can get involved with throughout Vanderbilt and at our rehab hospital. Something new is we've gotten residents involved on some of the Encompass Stallworth Rehab Hospital committees to kind of give a resident perspective to help kind of for patient care, and then also from a resident perspective.
In terms of vacation time and kind of some general perks of the program, from PGY 2 to 4 year, you do get 15 vacation days per year that are not assigned, which is great. So you would get to kind of take them as we like for different events that are, come up in the year. We also get 2 additional personal days per year that we are able to use as we need. 5 education days per year, which are for conferences or other academic endeavors. 5 interview days per year, and that's between PGY 3 and 4 for either fellowship or for private job interviews. We get $2,500 for education funds yearly, and that goes towards conferences, books, or other equipment or things that we might want. There's tons of free food. As intern year, you get lunches most days of the week. And as PGY 2 to 4, there are always snacks well stocked in the PM&R department. We get lunches with all of our academic half days once a month. And access to free coffee and everything like that as well. Devin added friends on here too, because that is definitely a perk of the department. We love to be around each other. So coming to work every day is a great thing because we get to hang out with our friends all day long.
Yes, I did that on there, add that on there. And that last picture on the previous slide was also intern year. You get to meet a lot of awesome people at Vanderbilt who become lifelong friends. That's another perk of having all 4 years within the Vanderbilt system, is you get to meet all these internal medicine people who are great, and then have friendships that go on beyond that intern year that you all share together. As far as additional benefits that Vanderbilt offers, kind of some of the basic things. So health, dental, vision, all those things that you would expect. I think a nice thing is that they do have matching after the first year up to 5%, which is really nice. No state income tax in the state of Tennessee, so that actually gives you a little bit of money back to yourself with the stipend, which is really good too. We do get a work phone and a laptop this year, was something that they added. as well as an iPad intern year. So those are all cool things that, are nice. And then just, we've had a lot of people having babies within our department. So another nice thing is that you have 6 weeks of parental leave. So that's been a good thing for the people who have had children in our time as residents, and then just basic white coat laundering. So.
And like Devin mentioned, so no state income tax, and GME office has been really good about adjusting our income every year. So this was from 2023, and then effective 2024, you can see the increase based on inflation and also cost of living that they're adjusting for, to make sure that we can all live comfortably on our salary. I know we're running out of time, so I'll just kind of go through this briefly here, but Nashville is a fabulous place. We love this city. It's also known as Music City. There's no shortage of things to do. Tons of music, from country music, jazz music, rock music. All the big artists come and give concerts here. Sports is always fun to go to and also to be involved with. Residents are involved on the intramural side. There's intramural soccer, flag football, volleyball, kickball, everything that residents are involved in. But we also have professional. We have NFL, NHL, MLS, and then minor league baseball, for those who like to attend the games as well. Tons of outdoors, beautiful parks, museums as well, and very, dog friendly. That's my dog there that made it into the slideshow, getting to go on one of the hikes. Tons of food. These are all pictures that I've taken from amazing meals that I've had in Nashville. Just incredible food of all different kinds. And we all like to go out to eat together. And then just some, work hard, play hard is kind of our motto. So different events or, things that the residents have done together here. As you can see, we like to hang out with each other. All right, well, that is all we've got. We've got our emails, both Dr. Shannon and myself, and then Irene, who's our wonderful program coordinator. Also got our Twitter account and our website, so feel free to reach out, and happy to answer any questions as well.
Yeah, thank you guys so much, Dr. Shannon and Dr. Fry. Really appreciate the presentation. It was fantastic.